Does any member wish to give a notice of a motion? Notice of a motion? Okay, Honorable Kid.
Thank you, Chairperson. On behalf of the African National Congress, I hereby move without notice that the Chinese President, Dr. Li Yanshu, has commended the Port Elizabeth-based Kucha Industrial Zone as the best IDZ he has seen in developing countries. Also notes that the congratulations by the IDZ for its recent accolades as a top-performing public sector organization in South Africa. Also note that Chinese Vice President was accompanied by the Eastern Cape Premier, Phumulo Moswale, and MEC Sakumzi Somyo in a meeting aimed at strengthening the bilateral ties between provinces in the two countries. Therefore, call upon Eastern Cape government to continue supporting the Kucha IDZ so that it can continue to play a leading role in developing economic countries in Eastern Cape. Thank you very much.
Thank you very much, Honorable Kaila.
Thank you, Chairperson. On behalf of the United Democratic Movement, I move that the House notes that on the 23rd November, it was reported that Mrs. Pam Green helped a stranger who was pushed out of a moving car along the highway in Joburg. Further notes that this stranger was a woman and was injured. Recalls that the perpetrator is alleged to be the woman's husband. It is also alleged that the police who arrived at the scene stopped trying to get a statement from her after the woman confirmed that the perpetrator was her husband. Condemn the actions of the police who were called to the scene. Congratulates Mrs. Pen Green for a heroic action. Calls on the House to double its effort in advocating 16 days of activism for non-violence against women and children. Thank you. I so move.
Thank you very much, Honorable Member. Special Delegate from the Eastern Cape.
Yes, sir. Thank you, Honorable Chair. On behalf of the Democratic Alliance, I hereby wish to move a motion without notice that this House knows that 3 days ago, a 9-year-old from East London in the Eastern Cape has been given a new lease on life thanks to the Paralympian Ernest van Dijk, who gave him the prosthetic legs. Ubuko Mpotulo lost the use of his legs at the age of 3 due to a rare disease. At last, he is able to walk and play with his friends. As the world commemorates Disability Month, the story of Ubuko is a beacon of hope for many and a lesson that teaches us to love and care for one another regardless of race. That this House acknowledges Ernest van Dijk for his love and what he has done for Ubuko. I so move.
Thank you very much. Is there any? I saw your hand, Honorable Mukwe. Notices. Is your hand up, Honorable Member?
Have you signed it, please?
Honourable Chair, I've got a motion without notice, similar to the one that was, you've already handled a motion without notice. Is that where we are now?
No. We're dealing with notices of motions. So in the absence of any member wishing to give a notice, then we can proceed.
Chair, I just want to point out to you that the previous motion was a motion without notice, and you didn't then procedurally handle it.
Was it a notice of a motion or a motion without notice?
It was a motion without notice.
Okay. I take it that there are no notices of motions anymore. So can we then take it that that was the first notice of a motion or motion without notice? Is there any objection to that motion? Is there any objection? In the absence of any objection, then the notice will read, will be adopted in terms of Section 65 of the Constitution. Can somebody just note names for me? Honorable Moab.
Thank you very much, Chairperson.
Chairperson, I move on behalf of the ANC a motion without a notice. I hereby move motion without notice on behalf of the ANC that the Council knows that the President Jacob Zuma will on Friday the 25th of November 2016 launch the 16 days of activism of no violence against women and children campaign at Leboa Khomo Civic Center, La Pella Nkumbi local municipality in Limpopo province. I further knows that the 2016 event will be marked under the theme Count Me In, Together Moving a Non-Violent South Africa Forward. Also knows that as part of the campaign, government will also convene a series of national dialogue sessions on violence against women and children across the country towards finding collective solutions to end the abuse in our communities. Therefore, call on the people of South Africa to support this campaign to make sure that the scourge of violence against women and children is not tolerated in our country. I so move.
Is there any objection to the motion? Therefore, the motion is agreed to. You may proceed, Honourable Member.
Thank you, Honorable Chair. I hereby move without notice that the Council knows with profound sadness and dismay that the woman police officer, Constable Amanda Ladlogova, 33 years of age, was shot dead in Philip East on Tuesday, leaving behind her family, including a 9-month-old child, and her colleague is in serious conditions in hospital. Further knows that the officer had just finished serving a protection order at one address when they were approached with a similar complaint within the very same vicinity. And on their way to assist, they were suddenly allegedly shot at by about 3 armed men who subsequently robbed them of their firearms before they fled the scene. Further knows that 4 months ago, it was reported that the Western Cape had until then had the most police attacks in the country for the year, whereby the national figures are 714 and 276 of those in the Western Cape alone, and takes this opportunity to call upon the respective authorities to maximize the effort to combat the scourge of criminality and attack of police officers. Our heartfelt condolences go to the families and friends. I so move.
Is there any objection to the motion? Therefore, the motion is agreed to. Honourable Hattie.
Thank you, Chair. It's really sad that we have to bring these motions in this 16 days of activism. On behalf of the Democratic Alliance, I hereby wish to move without notice that this House records its shock and dismay with the murder of S.P. Koster, an official at Raboni Christian School in Brits. She was brutally shot from behind after offering a lift to 2 pupils. According to the South African Police Services statement, the 2 learners, aged 16 and 17, were arrested on charges of murder and hijacking. I further move that the House conveys its condolences to the bereaved family. I so move.
Is there any objection to the motion? Therefore, the motion is agreed to. Honourable Mokwele.
Thank you, Chair. I move on behalf of the EFF for the House to note that the passing of Honorable Councillor Rocky Malebana Meeting from Rustenburg, Bojanala region in Northwest. Rocky passed on after being admitted in Pretoria Hospital. He was an outspoken person who was fighting corruption and money laundering in the Northwest Province and in Rustenburg local municipality. He serves the province of Northwest as an MEC for agriculture during the time of Popomolefe regime and later relocated to Rustenburg as a councillor. His passing on left a vacuum in the province and community of Kanana village and Rustenburg municipality that he was leading. May his soul rest in peace. I so move.
Is there any objection to the motion? The motion is therefore agreed to. Honorable Manopole.
Thank you, Chair. On behalf of African National Congress, I hereby move without notice that the Council notes with profound sadness with the death of the CEO or founder of Chicken Nicken, Mr. George Sombons, last week at the age of 67 after a long battle with cancer. Further notes that the business acumen, dedicated and inequality lead to his building of one of the most popular food chain in South Africa, and takes this opportunity to convey its profound sadness to the Sombosman family and friends to their loss. I so move.
Is there any objection to the motion? Therefore, the motion is agreed to. Honorable Koni.
Thank you, Chairperson. I rise on behalf of the EFF for the House to note that Kirumudi Jepuduhudu from Kuruman in the John Taulo Haitsewe region, Northern Cape Province, has been missing for about 9 months now. She left behind 4 children. Kirumudi's case has been dragging since then, and there is no update from the side of the police. We therefore call upon the Department of Police to speed up the investigation, as her children and family are struggling to cope with loss. She was last seen traveling to Vryburg in a car with a certain pastor. The family would appreciate to see the alleged suspect apprehended, as he is a well-known person in that particular community. I so move.
Is there any objection to the motion? In the absence of any objection, therefore the motion is agreed to. Honorable Zwane.
Thank you, Deputy Chairperson of Council. I hereby move without notice to the Council that 1, Council notes with utmost concern the result of the study by Save the Children South Africa, which shows that violence against children cost the economy of this country over 238 billion last year. Further notes that the study, which used researchers from the University of Cape Town, the University of Edinburgh, and Georgia State University, focused on physical violence, sexual violence, emotional violence, and neglect to understand the prevalence of violence against children in the country. Thirdly, Council acknowledges that the findings of the study brings a new dimension in the fight against the abuse of children and violence against children, as well as the urgency in which the scourge of child abuse must be dealt with as a matter of urgency because of its enormous cost to the country and the innocent lives. And this should be one of the cornerstones of our national investment to a better and a prosperous South Africa. And fourthly, Council takes an opportunity to congratulate Save the Children South Africa for their efforts in aiding decision makers, especially parliamentarians, with such crucial information in the fight against violence against children in the country. I so move.
Is there any objection to the motion? The motion is therefore agreed to. Honorable Peters.
Thank you, Chairperson. On behalf of the ANC, I hereby move without notice that the Council, 1, notes with utmost concern the increasing number of churches and pastors who continue to use dangerous and unorthodox practices. 2, further notes the recent claims made by Pastor Litibu Rabalago, who runs the Mount Zion General Assembly in Limpopo province, who claims he can cure cancer and HIV by spraying doom pesticide into people's faces. 3, further notes that this case comes after months after Pastor Penuel Ngoni of the End Times Disciples Ministries, who made members of his congregations to eat snakes and rats and even drive a car over some of them with the claim that it will heal them. and the emergency of pictures on social media of a church where congregants are made to dance with alligators. 4, takes this opportunity to warn our people to remain vigilant against exploitation by people who use dangerous practices to put their lives at risk to cheap publicity. And 5, calls on the Commission for the Promotion and Protection of Rights of Cultural, Religious and Linguistic Communities to working on measures that our country can put in place to deal decisively with churches and people who use practices that endanger the lives of people. I so move.
Is there any objection to the motion? In the absence of any objection, therefore the motion is agreed to. Honorable Sibia. Oh, I'm looking at the back there. Okay. You may proceed now. You may proceed.
Thanks. I hereby give notice that in the next sitting of the Council, I shall move that the Council, 1, notes and debates the exorbitant cost of private basic education in South Africa, including by the category of schools that are subsidized by government. And 2, further notes that the fees of some of the schools at basic education level are triple the amount charged by some higher institutions of learning in our country. I so move.
Is there any objection to the motion? Therefore, the motion is agreed to. Honorable Labuskaghni.
Thank you, Chairperson. On behalf of the Democratic Alliance, I hereby wish to move without notice that with a reference to taking Parliament to the People Plenary on Friday, 18 November 2016, the Chair ruled that the President is allowed to speak as long as he wanted. That the ruling was biased, as Rule 45.1 reads as follows. Except where the rules provide otherwise, members may not speak in a debate in the Council longer than the time allocated to them in the list of scheduled speakers. Note that Rule 45.2 reads, if or insofar as time have not been allocated, the President, the Deputy President, and the Council member in charge of the business before the Council may speak for as long as they need. Therefore, note that 30 minutes were allocated to the President according to the speakers list. Note that the chairpersons do not adhere to the rules of the NCOP and is therefore closing the democratic space in the NCOP in favor of the ANC. I so move.
Is there any objection to the motion? Therefore, the motion is not agreed to, and then it will read as a notice. Honorable Manopole. I did call you. Okay, you may proceed, Honorable.
Thank you, Chair. On behalf of the ANC, I hereby move without notice that the Council note that the 2 companies that collided and fixed the prices for their submission for a tender for the provision of cleaning services to the Western Cape Department of Agriculture have been fined after admitting contravening the companies contravening the Competition Act. Further note that both companies were fined 1% of the annual turnover of both firms for the year to February last year, which meant that Zero Cleaning Services will pay the Competition Commissioner 167,242,000 and top top nose services will pay 36,935,000. Acknowledge that this case will send a clear and decisive message to companies that continue to collide in order to defraud the state that their days too shall come. I so move.
Is there any objection to the motion? Therefore, the motion is agreed to. Honorable Khai.
Thank you, Honorable Chair. On behalf of the African National Congress, I hereby move without notice that the Council notes with great sense of pride the partnership between the family of the late Secretary General of the South African Communist Party, Comrade Chris Tembisileani, and the Ekurhuleni Metropolitan Municipality to turn the house of this late stalwart of our movement into a museum. Further note that the heroic international stature of Comrade Chrisani represent the collective heritage of struggle for peace, freedom and justice of the people of South Africa, united in diversity, and takes this opportunity to extend our collective gratitude to the Hani family and the Ekurhuleni Metropolitan Council for this courageous and patriotic venture, which will preserve and pay homage to the legacy of Comrade Chrisani for the indelible contribution he made in our fight for liberation and democracy for all our people. I so move.
Is there any objection to the motion? The motion is therefore agreed to in terms of Section 65 of the Constitution. I've got two last names, which is Honorable Lond and Honorable Kaula. The hands that are coming up, it's like it's an afterthought. No, Honorable Mtetwa. I don't know what is wrong with Honorable Kaula with me today. No, let me take, Honorable Mtetwa, let me take Honorable Lond first.
Thank you, Deputy Chair. On behalf of the Democratic Alliance, I hereby wish to move without notice that this House congratulates the Western Cape government on achieving 100% clean or unqualified audits for the second year running for all provincial departments. Further, the Western Cape Department of Health is the only department in its sector nationally to receive an unqualified audit, and the people of the Western Cape can rest assured that public funds are well spent, buys more services like healthcare, education and infrastructure, and attracts investment, stimulates economic growth, and creates jobs. I so move.
Is there any objection to the motion? In the absence of any objection, therefore the motion is agreed to in terms of Section 65 of the Constitution. Honorable Mtetwa. Honorable Mtetwa.
Thank you, House Chair. On behalf of the African National Congress, I hereby move motion without notice that the beginning of the festive season, where hundreds of people continue to lose their lives in road carnage that are fueled by speeding, reckless driving, intolerance, fatigue, driving under the influence of an utter disregard of road safety, and take this opportunity to call on all road users and law enforcement agencies to step up a campaign on road safety starting from the beginning of December 2016. I so move.
Thank you very much. Is there any objection to the motion? The motion is therefore agreed to in terms of Section 65 of the Constitution. May I take you as the last one?
Thank you, Chair. I hereby move without notice to the Council that it is with regret to note that the tendency to gun down councillors and murder them in cold blood continues unabated. Councillor Kwado Zakwela of the Ray Konyeni municipality was gunned down on Monday last week and was buried on Saturday. His contribution to the struggle for freedom and his leadership in SATU will never be forgotten. May his family and the South Africans be comforted by the fact that he has served us well. May his soul rest in peace. Thank you.
Is there any objection to the motion? Therefore, the motion is agreed to in terms of Section 65 of the Constitution. Honorable members, that brings us to the end of motions. The Secretary will read the order of the day.
Consideration of Provincial Week Report.
Honorable Nyambi, can you introduce the debate?
Honorable Deputy Chairperson, Chairperson of the NCOP, Minister, Honorable members, our special delegates, distinguished guests. The sign of the soil, the late Tanzanian President Julius Kambarage Nyerere, from his Stability and Change in Africa speech given to the University of Toronto, Canada on the 2nd of October 1969 said, I quote, "If a door is shut, attempts should be made to open it. If it is ajar, it should be pushed until it is wide open. In neither case should the door be blown up," close quote. It is the above attitude that should guide us in responding to how best we can work together to make access to education and health care for all. We are particularly heartened, Honorable Deputy Chairperson, by the decision to make education and health an apex priority, as the posture resonates with our icon, Tata Mandela once said, a good head and a good heart are always a formidable combination. But when you add to that literate tongue or pen, then you have something very special. We are also mindful of what his views are on education when you said education is the most powerful weapon we can use to change the world. The NDP commits all South Africans to a shared collective responsibility and vision to make South Africa work and solve the complex problems of the legacy of apartheid, particularly education and health as priority areas. Central to this resolve is the commitment to work together to make access to education and healthcare work for all. Among others, the NDP, the first one, it commits South Africans to leverage social responsibilities of democracy by achieving the following health priorities areas by 2030. Progressively improve TB prevention and cure, and universal health care coverage by ensuring that everyone has access to equal standard of care regardless of their income. And in achieving the objectives of the broader development framework, education has been identified as being a central component due to the role that education plays in building an inclusive society. It provides equal opportunities for all and aiding all South Africans to realize their full potential, particularly those previously disadvantaged by apartheid. The NDP further requires fundamental investment in education, childhood development, basic education, further and higher education. Ngomnyaka ka-2030, uMzansi Afrika kufuneka uqiniseke ukuba wonke umuntu uyakwazi ukufikelela kumfundo egculisayo noqeqesho kumfundo ephakamileyo eyakuthi isize ushintsho kwempilo yabantu nendlela esiphila ngayo. The performance of South Africans learners in international standards test should be comparable to the performance of learners from countries at similar level of development with similar levels of success. Education should be compulsory up to grade 12 or equivalent levels in vocational education and training. Honorable Deputy Chairperson, allow me to take you back to the objectives for this year programs, which intended to enable the NCOP an opportunity to follow up on commitments made in the delivery of education and healthcare services to communities, and to ascertain the progress that South Africa is making in meeting the commitments made in the NDP. Perhaps some may want to understand why it was necessary to step out of the parameters of Parliament and go to our respective provinces to engage with the real people on the ground. In the Eastern Cape, for instance, we learned that the province has taken progressive steps in strengthening of primary health care, which included enhancement of a province-wide community-based outreach services. In 2015-16, to enhance the coverage, the province activated mobile clinics, especially for deep rural areas. 241 primary healthcare sites were assessed to determine ideal clinic status. 15 of these were awarded ideal status, including Yetu, Elundini, Maletswai, Kaugeni, and Umtata. The remainder are on improvement programs to ensure our citizens receive quality healthcare service. Client satisfaction survey rates in the first quarter of 2016-17 show that the province is doing well. With regards to education, Honorable Minister, the department had a commitment to offer quality education and transform schools into centers of community activity. In 2016 academic year, the province saw an increased access to schooling for grade 9 learners. This improvement was largely due to strong advocacy programs that were implemented by the province. Further, the scholar transport system, though still requiring improvement, continue to play a role to enhance access of schooling to learners in disadvantaged communities. There was good progress in areas of functionality of SGPs, which are a key feature in schooling system. There are programs of teacher development, mentorship of headmasters, and recruitment of principals to enhance functionality of schools. We were able to attest to some of these in our recent Taking Parliament to the People program held this month in Eastern Cape, wherein most members present today saw. It will not be surprising, though, to learn that in the same debate, some will decide to act as if this is new information. Honorable Minister, we are aware of the challenges that are there, and we are happy that you are present today. For an example, in the Northern Cape, we noted the issue of learner transport, the lack of communication between the two departments responsible for learner transport was an issue of great concern. In addition, it was unacceptable that there was no reporting by the Department of Transport Safety and Liaison, as these contravene the Public Finance Management Act. We committed that the NCOP will go back and check whether there was a national policy framework in place, as there was an undertaking in the 4th Parliament by both departments that such a framework will be developed. We hope that this information has served before you, Honorable Minister. With regard to overcrowding in classroom, members were deeply concerned that there was still severe overcrowding in schools in townships and poor areas. Our members wanted to know what the department had done regarding the problems, especially in the JTG district. As such, we requested that the names of overcrowded schools be supplied. Through our committees, we should be able to look at these schools and make sure that through our oversight activities, the status quo is improved, Honorable Minister. Atsaka kuvona leswaku xifundzhankulu xa le Northern Cape xi endla magungu ya ku nyiketela hi ndzhawu ya mpfuno vafambi ya heriswa xiphiqo lexi tiviwaka ya mafambi ya HIV and AIDS ni swikanyakanyaka swo tala. Honorable members, will recall that we're in Limpopo for the same provincial week in 2015. In briefing by the Premier this year, the following progress was appreciated. The province has invoked Section 18 of the PFMA in Education Department. The AG was also involved and had indicated that there was progress in the department. Honorable Chairperson, it remains puzzling that when we find opportunities to give credit where it's due, we tend to choose selectively, unfortunately end up ignoring to comment where there is progress. Our interface with government departments, entities, municipalities, and private sector through our oversight activities, committee meetings, plenaries, and other fora must be able to indicate to us whether or not there's any improvement subsequent to the programs, such as Provincial Week or taking Parliament to the people. Where necessary, the right interventions must apply it by all means. When we make time to conduct oversight and engage outside our comfort space, we must always put aside party politics, often guided by a tongue-lashing exercise at the cause of those that were elected to represent. I hope that even today we'll be hearing stories that seek to build than to destroy. We need to make input that gives hope to those that we serve. In Mpumalanga, we know the undertakings made by the Premier, wherein he cited several key interventions to speed up service delivery within the Likwa local municipality area district. Sikushayela tandla kutsi umhlonishwa Titi Mabuza wende tibopho nekuti nikelela kuqiniseka kutsi bomasipala basebenzisane nawo wonke amatiko ahulumende ekwendeni isimo senhlalo lizinga lemfundo netempilo ukuthi kube sezingeni lelamukelekako. Kubalulekile kutfutsa kwendle, kwabiwa kwagezi, mandi, kwakhiwa kwetindzawo tekuhlala njengetintfo letitawuhanjiswa embili. During public hearings across all provinces, one recurring motive was that committees pleas for better service delivery in most of our healthcare facilities. Through our efforts to roll out these facilities are being intensified, their relevance can only be given a life by committed workforce. I therefore wish to refer to a quote by Mahatma Gandhi, who, when faced with situations similar to ours, he said, open quote, "A customer is the most important visitor on our premises. He is not dependent on us. We are dependent on him. He is not an interruption in our work. He is the purpose of it. He is not an outsider in our business. He is part of it. We are not doing him a favor by saving him. He is doing us a favor by giving us an opportunity to do so," close quote. In conclusion, Honorable Deputy Chairperson, given these commitments, today's debate should be able to assist the following. The first one, it must harness our collective effort in ensuring access to both primary health care and education. The second one, it must also be able, through our committees, to follow up in all our engagement with those that are responsible and are accountable to these commitments, Honorable Minister. And we must be able to accelerate infrastructure delivery management and maintenance. The last but very important one is to strengthen monitoring and evaluation of our system, as well as intensify our oversight mechanism. I thank you, Chairperson.
Thank you very much. Honorable Mpumalanga.
Mandisibusele kuwe sekela mhlali ngaphambili walendlu yengwevu obekekileyo. Okokuqala, Honorable Chair, education is not preparation for life. Education is life in itself. When looking at this issue of quality education, it is imperative, Chairperson, to tackle it at the grassroots level, specifically on quality education, starting with basic education in order to prepare learners for secondary and higher education. Would like to commend the Western Cape Education Department on their outstanding performance over the past couple of years. The Western Cape Education Department has aimed to achieve strategic goals rather than just achieving numbers. The Western Cape Education Department further administers independently set grade 3, 6, and 9 tests in language and mathematics. This reaffirms that the DA-led government is devoted into investing the quality of their results. Furthermore, systematic tests such as annual national assessment are administered, tested and marked by competent external service providers in the Western Cape. Due to these practices being put in place, the quality of language and mathematical education has significantly improved. However, this is not reality that is experienced by every province in South Africa. Honorable Chairperson, the Eastern Cape is in dire concern as it has been the worst performing education department. This province has been the home of the lowest matric pass rate continuously over the past 5 years. In 2014, Chairperson, more than 34 out of 100 matriculants failed to obtain a passing grade. These are the results of the lack of policies and strategies that were not in place to ensure functionality in schools. The lack of the ANC's government-sustained interventions in schools has resulted in poor performance. The DA has seen improvements in schools with high proportions of historically disadvantaged learners thanks to our Western Cape Education Department. These interventions, Chairperson, include learners having textbooks to assist them with the process of learning. In addition, Chairperson, Western Cape Education Department has ensured that the learners and the teachers are trained and fully equipped in assisting children with any challenges they may face whilst learning. As it comes to the health sector, Chairperson, is another problematic governmental sector in our country. However, due to our country's historic and our socio-economic realities, we find that majority of our country's population is dependent on public health, whilst a minority of only 20% is able to afford private health care. The consequence of this is that the public health system is under an immense amount of pressure to meet the demands of the public, while still being, in most provincial areas, significantly under-resourced. According to the medical research Chairperson, our country faces a quadruple burden of disease such as HIV and AIDS, underdevelopment, chronic disease, related unhealthy lifestyles and injuries. Current statistics show that provinces such as KZN, Mpumalanga, and Eastern Cape are rated as having high rate of HIV/AIDS prevalence. Again, Chairperson, the same provinces are also found ranked at the top of the list for high prevalence of TB. It is important to note, Chairperson, that in both surveys, the DA-run Western Cape was ranked as having the lowest prevalence of people living with HIV and AIDS and TB. This could be attributed to the fact that the education system has year after year proved to be a better quality and standard, or it could be because the fact that we make sure that we are constantly in sync with our public health care system, ensuring that all necessary resources are available timelessly and all arising issues are prioritized to deal with accordingly. The DA has pledged ourselves to ensure that South Africans are able not only to realize their constitutional right to education and health care, but are also fully exercise those rights. We are committed to producing a well-cared for and well-educated, democratic and equal South Africa, as well as South Africa with a health care system that promotes and protects healthy living in order for us to truly realize and reach our developmental goals. Honorable Deputy Chairperson, the current state of our education and health care system is inadequate and in dire need of situation. We as the DA believe that South Africans deserve a party that will serve them and look after their basic needs and interests. Let us stop the cycle of producing undereducated youth and incompetent cadres deployed into health facilities and education facilities, because this becomes detrimental to the government failures. Let us start instilling hope and trust in the South African people's perception of service delivery by doing away with practices that fall and adopting more dependable approaches. As Honorable Nyambi has just stated, we need to structure and mold and nurture and nourish each other. And my advice to the Minister is that let's take the best models from the Western Cape province and allow freedom, fairness, and opportunity to be afforded. Let us be a better South Africa and benefit the South African child accordingly. Ndiyabulela mhlali ngaphambili.
Thank you very much, Honorable Peter. Continue the debate.
Honorable Deputy Chairperson, Minister of Basic Education, permanent delegates amongst you, Umama Chief Whip, Siyabulisa, and guests. Chairperson, it is always a pleasure to me to be debating in this House, more especially when NCOP is debating matters of societal importance. Chairperson, the recent NCOP Provincial Week provided an opportunity to communities and organs of civil society to engage their representatives in Parliament on what they see as solutions to factors that have an effect in delaying service delivery. Our engagements with school principals, SGPs, which are organs of people's power in the sector, labor unions, and traditional leaders in their respective communities, provided us with a thorough and scientific analysis of the factors that make some of our schools not to work as they are supposed to. Chairperson, our view in the Eastern Cape is that the department is confronted, and it is confronting the challenges of a changing education system. We are not living in an island, we are part of this republic. Over the past 2 decades of democratic dispensation, the budget of people's education has increased dramatically. In this financial year, Chairperson, others were not part of the visits, Chairperson. That is why they speak loudly. They must listen. In this financial year, Chairperson, Treasury has allocated an amount of 31 billion for the Provincial Department of Education to run its programs. And a big chunk of this budget is biased towards quality teaching and learning program. This is what education is all about, where there is a teacher in front of learners in a classroom teaching at least 7 hours a day. Other programs are about creating a conducive environment in schools so that we deliver quality education.
Just hold on, Peters. Can you take a seat? What point are you raising, Honourable Member?
I just want to ask the honorable member that would he take a question?
Are you prepared
After
to
the
take a
sitting,
question?
Chair.
Okay.
No, where will
No.
you?
No, he's not prepared to take a question.
Chairperson, the ANC is still committed in making education a foundation from which we build the future, and it must be a key to our economic growth and social stability. This is the definition of the ANC. It is totally different from that of the DA. And therefore, Chairperson, the reconstruction of a people's education system is no easy matter. It needs support from all sectors of society with the aim of creating a new, a best, and a responsible citizen for the country to prosper. Our education policy is focusing more on making education accessible to the majority of those who are in the periphery of the economy, so that they are not condemned to the status of being better laborers, whilst those coming from affluent backgrounds enjoy the best opportunities. As we speak, Chairperson, 68,000 of learners in the Eastern Cape are covered on scholar transport program. Although, according to the Department of Education, learners in need, the number is around 95,000, but we're increasing the numbers every year. We still have a challenge as far as infrastructure is concerned, and the Department of Basic Education must work hand in hand with the Provincial Department and support in building its capacity so that it will be able to roll out infrastructure development in areas where there is greater need of new schools. The reason for this, Chairperson, is that education remains a concurrent function between the province and national. We need a radical and a comprehensive program to eradicate inappropriate structures, more especially in the eastern side of the province. The backlogs, Chairperson, in fact, development has never been an event. It's not a miracle. It's an ongoing program which needs a concerted effort. We appreciate the ASIDI program, which resulted to the province handing over about 50 schools to communities. And we are looking forward to the next number of schools under this program of ASIDI, because it is changing the situation for the better. Chairperson, the conditional grants which were allocated to the province exposed the lack of capacity within the Department of Education, and the role of implementing agencies will need to be reviewed as we move forward. I will agree, Chairperson, with some of the speakers on the migration of learners between Eastern Cape and Western Cape and Gauteng to some extent. And this movement is historic between these provinces, and it is caused by inequalities of human living. Honorable Chair, all countries that have gone through a period of transition post the period of colonization had to confront similar challenges. The same challenges that faced Kenya in the 1960s are what South Africa is battling with today, because we're also learning from the second world countries as they have gone through the same journey towards their development. The questions for this debate are, one, how education can be changed to suit the new context, and two, how education can bring about a new African child. These are questions for debate. In conclusion, Chairperson, as the ANC and government, we have a mandate and a power to make it happen what Madiba said. I quote, South Africa needs a new system of education which must ensure that a child of a farm worker becomes a leader of a great nation, and a child of a mine worker becomes a manager of a mine, and a child of a poor woman becomes a doctor. We have a mandate, Chairperson, and the power to achieve Madiba's dream and vision about people's education. Thank you.
Thank you very much, Honorable Kaula. Finally, I got you right now.
Honorable Chairperson, the KZN Provincial Week of 12 to 16 September 2016 focused on education and health in the Herigwala Sisonge district. The projects visited over 3 days in the district were Polela Community Health Clinic, Underberg Clinic, Tugiana Primary School, Vulegani Special School, St. Margaret TB Hospital, Glengarry Primary School, Zwelinzima Senior Secondary School, and East Griqualand and Asha Memorial Hospital. We had our briefing session on Tuesday, 13th September in Pietermaritzburg with the Education MEC and the Health MEC before visiting all these sites. Our observation with the Health Department were that the department is trying the best it can do under the very trying circumstances. Herigwala is a deep rural district. As a result, it is difficult to attract and retain the scarce skills in the area. Especially in Polela CHC, we met the CEO, who is a very dedicated young man, Dr. Kumede. Also at St. Margaret TB Hospital, which is a very old hospital, but the staff are doing their best. The Department of Health must prioritize the building and improving of structures in Sisonge. St. Margaret TB Hospital is a mud hospital, something that one cannot think of at this day and age. Government should stop promising heaven and earth and deliver nothing. St. Margaret Hospital was promised by MEC Dr. Dlomo that it will be relocated to new buildings years ago. The hospital board reported that at some point, they were even invited to a budget speech day in Pietermaritzburg by the MEC. Later, the MEC backtracked and pretended not to know what the board was talking about when they were making follow-up on this non-delivery. Government also needs to prioritize increasing health emergency vehicles in that district, as this is causing a problem in operations. It is a pity that KZN Health is reported to have underspent even with these challenges. With regard to education, Sisonge district has a huge management crisis. The district management is lost on issues. The circuits are lost. This is all due to cadre deployment because the district manager is the type of that animal. Presentations on education were badly prepared. Sometimes the district was not available to give clarity on issues. At Togiana Primary School, NSNP is badly managed, Honorable Minister. The school uses firewood on 3-legged pots outdoors. This is a common scenario in most schools in that district. At Vulegani Special School, matters are even worse. This is a school for physically and mentally challenged learners. Administration is in tatters. There are allegations of sexual abuse of these learners by a staff member who is still at the school. There are buildings which were supposed to have been completed 5 years ago but are still unfinished. The reason is because the contractor failed to deliver and abandoned construction. Learners are supposed to be transported by bus, but the bus has broken down and learners, both from hostel and local area, are unable to go to school if parents cannot afford alternative transport. It was reported that sometimes learners receive tuition from the hostel because of this transport problem. The hostel itself is in tatters. After our visit, these matters were all over the Sowetan of 26 September under the heading, I quote, abuser cuts pupils, unquote. And on 27 September under the heading, quote, shocking condition at school of shame, unquote. The caption talked about overcrowding, mud classes, stinking toilets, and that pupils are not getting the attention they deserve. Surely, education is suffering a lot of challenges in Herikwala district. Some parts of the district are in government circles categorized as urban, for example, Kokstad. As a result, they suffer when it comes to packages of rural allowances to staff. The issue of non-payment of correct categories of rural allowances does impact negatively to recruitment of personnel in Sisonke and Herikwala district. In conclusion, Chair, one appreciates that during our provincial week, we were in the company of provincial portfolio committee members of both education and health. Both committees committed to urgently go back to the district to follow up on the issues that were seen as burning issues. I thank you, Chair.
Thank you very much, Honorable Sibia. Can you continue the debate?
Thank you very much, Honorable Chairperson, members of this House, the Minister. Chairperson, let me take this House through some reflections that are a reality that I think it's very important that maybe we share with them. Certainly, the Speaker who was just here belongs to those who made sure that we don't prosper. Honorable Chairperson, let me take this opportunity and firstly acknowledge the reality I see today. Never even once ever thought we will be standing on this podium as blacks. Not even the wildest dreams we ever thought the brutality of a white man will be brought to its knees. After 22 years of democracy, we can indeed certainly tell a tale of how things have changed for the better in this country of ours, thanks to the People's Movement, which is the ANC. Honorable Chairperson, I'm just a rural boy from Engu to KZN, who grew up drinking from the river with no electricity, health facilities, water, schools, and proper roads. Today, let me tell you, things have turned around 360 degrees. We have a clinic, proper schools, proper roads. We are no longer drinking from a river, but from a tap. We have never dreamt of such a quick change in improving even the life of a deep rural and remote area, which is in Engutu. Who has ever thought, Chairperson, a black man will have an ambulance fetching him from home when he is sick? To us, that was a dream. It's something that we never thought it will happen. But today, Chairperson, you see ambulances in deep rural areas and in mountains fetching our sick people. That's the reality, Chairperson. Chairperson, I then sit back and reflect and ask questions. Why apartheid government never allowed us to have access to such basic needs? And Chairperson, you realize that we never mattered to them. We're treated like animals. Their brutality can never be forgotten. I always wonder what can change them today in blue. But the reality is that they will never change. All they want is to still get into power and continue brutalizing us and nothing else. That is why even today some see some blacks who are, in fact, that is why even today some see blacks as nothing but just a conduit and a tool for them to get back to power, and we see some of them here today. Sadly, some have never allowed themselves to be used. Sadly, some have allowed themselves to be used to advance the apartheid agenda that is still, we see its legacy today. They don't even see anything wrong because they are blinded by being honorary whites. I'm raising this in the midst of a sad story, Chairperson, which I think we can't ignore it, where Mr. Mlojwa in Mpumalanga was put in a coffin alive by two white men in Mpumalanga recently. It's a reminder to us that we easily forget and forgive, but they still see us as animals and nothing else. Let us not forget, Chair, that things have been changed to some amongst them. They still see us as enemies. In the words of Thomas Sankara, Honorable Chair, he says you cannot carry out fundamental change without a certain amount of madness. In this case, it comes from non-conformity, the courage to turn your back on the old formulas, the courage to invent the new future. Indeed, we're at a point where we need to change and move with speed in radically transforming the lives of all South African people. KZN has moved mountains under this government to improve the education standard of the rural people in that province. The work that has been done is out there for everyone to see it. During the NCOP visit, weak members who were part of the delegation can attest to that. Let me take through Ubabu Kaula, who was here, that the Portfolio Committee of Education in the province of KwaZulu-Natal went to attend all the issues that were identified by the NCOP, and all of them have been addressed by the Portfolio Committee and the Department of Education of KwaZulu-Natal. That's how swiftly we move in addressing challenges. We don't wait, Honorable Chair. The infrastructure that has been put in place in many of the new schools is an indication of the province that strives for excellence. We are known to be the biggest province with maths learners writing matric this year. In fact, we are unmatched because we want to produce learners who can contribute meaningfully to the economy of our country.
Honorable Sibiya, can you just take a seat? On what point are you raising, Honorable Member?
Chair, assistants, in regard to Rule 33, members are disturbing the member on the podium. Thank you, Chair.
I think it's a fair comment. Let us not drown the speaker, but try to listen to the speaker. On what point are you raising, Honourable Member?
Chairperson, yes. As I don't want to drown this honourable speaker, would this honourable speaker then please take a question, as he is so verbally saying things? I would like to ask him a straight question, if he's not scared to answer me.
Honourable Member Sibiya, are you prepared to take a question?
No, Chair, I don't have time for that.
As I thought, too scared.
Take a question. Can you continue?
Thank you, Chairperson.
Just hold, take your seat, Honourable Member.
Honourable Chair,
Honourable Harting.
you made reference about crossing the line when we were in East London. I didn't mention it when this person mentioned cross the line.
Honourable members, I want to listen to what the member is raising. Can you allow me an opportunity to hear him out?
Okay, Chairperson, I understand that he's a new member, but in terms of Rule 51, the honourable member must do like you requested, sit down, when a point of order is being put.
Okay, the point
Please
is
sit
taken.
down.
Okay.
Are you raising a point of order? No. Stand up, and honourable member. I will instruct you to sit down.
Yes, thank you, Chair.
Are you rising on a point of order?
No, but I want to put my order when the member sits down.
No. Are you rising? I'm asking you.
I'm rising on a point of order.
Okay, honourable member, can you take a seat? Can I hear the order?
Honourable Chair, my point of order is in terms of Rule 51, that the honourable member must sit down when you order him to sit down. Thank you.
Can you continue the debate, honourable member?
Chair, at times age can be very challenging, I know. I understand the level of stress. It's very stressed, Chair, to see some of us here. Honourable Chairperson.
Just hold, Honourable Sibiya. On what
I
point
raise
are you
a
raising?
point of order, if this is parliamentary, to refer in a decorative way to a person's age. Chair, I want you to rule on that.
I didn't hear him pointing at any member with reference to age, but just a general statement about age.
Because that was not a general statement, that was a negative statement.
Honourable Labuskafni, can you take your seat, please? Can you continue, honourable member, of the debate?
Thank you, Chairperson. We have 167,000 matriculants writing this year. The KZN Education Department is the biggest in the country with a huge number of learners in its system, about 2.6 million, with more than 6,000 schools, which automatically with about 105,000 employees. This is a clear indication of the task at hand in the province. Sadly, the budget allocated to this province doesn't speak to this. We're appealing to this House that let us relook at the allocation given to KZN because it's almost impossible to have such a huge department, but its allocation doesn't match the need. Almost all of the budget has to fund salaries, which is not helping us to deal with other challenges. The Department of Education in KZN, in its quest to make sure that we produce quality and nothing else, has taken a bold stance in fighting irregularities during matric exams. The high level of monitoring is watertight, Chairperson, thus assisting Malusi to assure credible matric results. We have also taken a radical decision, which was long overdue as the province, to provide a girl child with sanitary towels for free in all schools. We've just launched that program. This will go a long way in helping our people in the province, especially a girl child. The NSNP program has reached a stage where we are all comfortable acknowledging what Mr. Honorable Kaula was saying, that 1.2 billion budgeted for it goes exactly where it's needed, and a black child is the main beneficiary to this. Honorable Chairperson, the status of health system in KZN has improved a great deal. Indeed, abantu bakithi sebephila isikhathi eside esihlalo. Thanks to this government of the ANC, the ARV program has managed to save many lives of our people. Our people as well now understand better what it means to use ARVs, and it's important to their lives. We are grateful, Chairperson, to Cuba as the province of KwaZulu-Natal. The Cuban program has managed to train about 131 doctors who are already working in our hospitals, and 338 will be coming back to start working in our hospitals in 2018. This is going to change the face of the province altogether. We are indeed grateful to our historical allies in the struggle. We say, may our permanent friend, the revolutionary par excellence, Fidel Castro's life lives forever. Our clinics found everywhere in the province are playing a major role in the primary health care. They are functional and responsive. We have seen a huge decline in queues that used to be found in hospitals. In closing, Honorable Chairperson, I want to borrow from Frantz Fanon when he says, for a colonized people, the most essential value, because the most concrete, is first and foremost the land which will bring them bread and above all dignity. Indeed, that's why the ANC prioritized the issue of land, so make sure that our people benefit from it. Thank you very much, Honorable Chair.
Thank you very much. Honorable Chipape, can you continue the debate?
Thanks very much, Honorable Chairperson. Chairperson of the NCOP, Deputy Chairperson, Honorable Minister, Honorable members of the NCOP, members of other provincial legislatures, ladies and gentlemen. 22 years ago, the government of the ANC had embarked on a program of building a new nation that is to be transformed in a quest to achieve a non-racial, non-sexist society united in its diversity. As a matter of fact, Chair, at the start of this transformation agenda, we started at a snail pace. However, today there is no doubt that more have been achieved in relation to building South Africa that upholds human dignity, social justice, and human rights. Today we are living in a democratic country wherein our constitution remains a guiding tool in our action in delivering basic services to our people. Democracy created opportunities and access to government services and protected our rights. South Africa today is better than it was before 1994. It is our belief, Honorable Chair, that the government of the ANC has done exceptionally well in delivering basic services to the people of South Africa. And this requires us from time to time to assess the progress we have made thus far, interrogate the shortcomings, and further plan ahead with a view that setbacks that are discovered does not find any expression in future. It is against this background that as the Limpopo legislature, we participated in the NCOP Provincial Week of the 12th to the 16th September 2016. Honorable Chair, the ANC in all its manifestos made commitments to improve health care in both urban and rural areas, and further to improve and promote education as the apex priority. As part of this commitment, the ANC-led government broadened access to adequate education and training as well as health care. The Provincial Week helped us to follow on these commitments that we have made to our people. As the Limpopo legislature, we focused in the Sekhukhune district, a highly rural and poor district, Honorable Chair. In the Sekhukhune district, we visited a number of healthcare facilities and schools. We met with SGBs, school principals, teachers, and other stakeholders in education as well as in health. We must report, Honorable Chair, that all of them want a better education and a better healthcare system. And they believe that the ANC is the only organization that can deliver this to them. Honorable Chair, education being the pillar of transformation and development has not been fully accessible in some cases to some learners who have to balance schooling and household responsibilities. In this case, I'm referring to those learners who have lost their parents through death and whose parents, others are working at farms, and these children are remained to be heads of their own families. There were some teachers who were affected by non-payment or late payment in some schools that we visited in the district of Sekhukhune. However, the Department of Education in the province has promised that the matter is receiving attention and will be dealt with. Honorable Chair, there are problems with our infrastructure at schools. In our province, most of the schools were storm damaged, and the Limpopo Department of Education is busy serving a program of addressing these issues of infrastructure. Generally, in the Sekhukhune district, Honorable Chair, in last year's matric results, the district did not perform well. There were some schools that underperformed. The district has presented to us during this week a turnaround strategy that has been implemented to assist the underperforming schools, and we hope this year the situation will be different. During this week, we visited a number of SEGET offices, amongst them the Mudze Central SEGET office in Mudze. The facility in which the SEGET is situated is incomplete since the contractor abandoned the project before completion. The decision to occupy this facility was taken in an effort to safeguard the building, although it does not have electricity, water, and enough furniture. This situation negatively affects the functioning of the SEGET. Honorable Chair, in the district, we were pleased to learn that the number of learners who are benefiting from the National School Nutrition Program in the district is 224,272 for primary schools and 144,664 for secondary schools. This is only in the district. In the province, the number is more than 900,000, while more than 5,660 learners benefit from the scholar transport in the district. In all the circuits that we visited, there were no schools that complained about lack of textbooks. So this is a thing of the past in the province. And we want to appreciate the Department of Education in the province for distributing textbooks on time this time around. This, Honorable Chair, shows that the government has been successful in its promise to deliver free and quality education to our people. Education remains a key priority to eradicate poverty. It remains key as a requirement for self-growth, self-recognition, and a tool of unlocking individual and collective growth as well as development. Honorable Chair, in health, TB is the most prevalent disease in the district, just like in the whole province. HIV and TB co-infection is also a challenge, but great achievement has been made with regard to case findings and management. The prevalent rate in this case is 20.3%. The Department of Health is embarking on intensified case finding through TB screening, testing, and linking patients to care. There are a number of findings that were made during this visit related to health issues, such as the shortages of staff, and in some cases, shortages of some medical equipment. The state of health in Limpopo is not dire, Honorable Chair. And at the same time, there are efforts to mitigate the status quo through improvising levels. Many clinics visited in the district do not provide 24-hour services due to shortages of staff, as I indicated earlier. We visited one hospital in the Ephraim Mohali municipality, Matlala Hospital. This hospital encompasses 2 towns, namely Groblersdal and Marble Hall. The hospital renders services to 67 villages that are around the hospital with 7 clinics, and all these clinics do not provide 24-hour services. This created a problem for patients who cannot travel long distances during the night to access the hospital. The Department of Health in the province promised that there are plans to increase 24-hour clinics to increase access at primary health care levels. Even though this is still a challenge, there is slow and low output of nurses required to assist in this regard. The nursing college that is there at the district lacks human resource because some lecturers and tutors migrate to more paying jobs, therefore rendering the nursing college unproductive and inefficient. Honorable Chairperson, most of the challenges that were identified, like the filling of funded vacancies, we agreed that they should be given priority by the department. It was also recommended that in both education and health departments, through the assistance of the Provincial Treasury, all these funded vacancy posts must be filled with immediate effect. We also made an undertaking as the provincial legislature that we need to ensure that all the recommendations made during this provincial week are fully implemented through the Portfolio Committee of Education and that of Health. And we believe that we'll continue to provide services to our people. I thank you, Chair.
Thank you very much. Honorable Kony.
Thank you very much, Chairperson. E re ke tse tšhono ke dumedise balwanto Afrika Borwa ka bophara diprovince go ya ka go latelana. South Africa is a country full of contradictions. South Africans CEO are some of the best paid in the world, while South African workers are the most underpaid in the world. These contradictions are also based on skin color, gender, and age. But the most appalling must be the differential access to basic government services, key among these being education and health between rural inhabitants and urban dwellers. Children in Gachana in the Eastern Cape are writing exams under trees as we speak, while children of the Open Hammers are writing exams in air-conditioned classrooms. While children of the miners who were mowed down by the police at the instruction of Ramaphosa and the ANC, now they are forced to have to read in candlelit rooms, studying in schools that have no libraries and computer labs. The children of Ramaphosa and owners of Lonmin have all the basic needs necessary for one to succeed in life. Rural schools have no good quality and qualified teachers. Rural schools have no libraries, no computers, no access to the internet. Is it any wonder, therefore, that rural provinces continue to be at the bottom of the ladder when it comes to the end of the year? Is it any wonder that universities continue to be flooded by white students who have had a solid base from which to develop their academic qualities? Is it any wonder, therefore, that jails continue to be flooded by young, brilliant black people who were conditioned from birth to be nothing but servants in a system of white supremacy that treats black people as fodder for their insatiable desire to loot more? While thousands of men and women who work deep in the mines of this country contracting tuberculosis and other dread diseases struggle every day to get access to good quality medication, the owners of these mines have access to private rooms in private hospitals. The sweat of black people in this country is for the benefit of white people and a tiny minority of black parasites represented in the main by the Ramaphosas of this world. Black people in Port St. John's have to die waiting for ambulances because these have not been properly maintained and cannot access remote rural areas. Black people in Pongola, in KwaZulu-Natal, die daily of preventable diseases because their clinics are not open 24 hours a day, and when they are open, they have no medication and no doctors, and poorly qualified overworked nurses. Is it any wonder, therefore, that young black women continue to die while giving birth because of the poor quality of health provision in rural South Africa? Is it any wonder that black men who have been used and spitted out by the mines continue to go back to rural areas to die a slow and painful death? This is the condition that our people have to face on a daily basis. Black people have been dehumanized, battered, and harassed every single day in their quest for access to basic health services. Our children are being turned to criminals on a daily basis because they cannot access anything that can change their lives, such as a good quality free education. The best thing apartheid leaders did for their ideology of white supremacy was to give over power to the African national criminals. And the ANC manages the state on behalf of white capital. It denies black people education so that there be a continuation of supply of cheap black labor. It denies black people good quality health care so they can continue buying cheap toxic medication from white pharmacies. The only hope for black people in this country is in the economic freedom fighters. It is only under the EFF that everyone in every corner in South Africa will have to access clinics that are open 24 hours a day. It is only under the EFF that there will be good quality free education in this country. The first step towards getting those services is the rejection of the ANC that is dying slowly, slowly, slowly. We must start imagining a future without the ANC. It is a future so bright, so glorious, under the leadership of the economic freedom fighters only. Thank you very much, Chairperson. Because I have 1 minute and 15 seconds. Whilst we are on our provincial week within the Northern Cape province, and I'm happy you were also there, the Department of Health HOD by the name Liz Waters continues to ill-treat workers within around the Department of Health, and she's a woman and she should be leading by example. Perhaps she's a mother also or a wife. That woman must lead by, it's not an allegation. That woman must lead by example or step down because she's not here for her own pockets. She must lead by example. Thank you.
Thank you very much. May I take the opportunity to welcome the Minister and to invite the Minister to continue the debate.
No ideology. No ideology whatsoever. I'm an IT expert.
No, thank you very much. No, thank you very much, Chair. Let me take this opportunity also to be able to participate in this debate, and we'll focus, unfortunately, on only 2 areas, unfortunately, on access, and I've also had some notes on quality, because we think it's a very important factor that we should look at as a sector. Just to put on record, Chair, we'll highlight our progress in terms of improving access, but also challenges that we meet in access. Just to put the context, Chair, we run a system with almost 23,710 public schools, which is equivalent to 92.8%, and which really represents more than 12 million learners, which is a sign that South Africa still has huge confidence in the public education system. Because of these, only 7.2% of our schools are private schools, which cater for only 4.5% of South African children, and only employing 38
educators. So as I say, I just want to make a point that South Africans still have huge confidence in the public education system, which gives us hope. We also have, as I say, in the 9 provinces, we have 81 districts, and the majority or the bulk of those districts are in the Western Cape. But even in terms of the funding, to confirm that the ruling party continues to prioritize education. As a country, we spend 15.6% of our budget in education, which comes to 226 billion, more than 226 billion annually. In terms of access, we are guided by both international instruments, but also by our own commitment to making sure that education is a priority and all our children have access to education. 30 years ago, the Declaration on the Rights of the Development set a firm commitment towards ensuring that all people, especially the most vulnerable in society, are empowered to participate fully in all areas of social life, and education in particular. Another center of this commitment is an understanding that the opportunity to participate in formal education is a key enabler for meaningful social participation. And in South Africa, the right to education is guaranteed in Section 29 of the Bill of Rights in a democratic constitution. Such local and international declarations do provide an impetus for us to continue to commit to education for all. In terms of access, which is a subject underway, Chair, we can say access to early education opportunities have increased substantially, and thanks to the rollout of the Grade R program over the past 15 years. Because the number of learners enrolled in this program increased between 2001 and 2015 from 200,000 to more than 800,000. And thanks to the Grade R program. So in 2002, for instance, Chair, 40% of our 5-year-olds were enrolled in some form of educational program. But currently, more than 80% of our 5-year-olds are attending Grade R institutions. We know that it's insufficient. We know that insufficient early education stimulation is one factor that contributes to the wide achievement gaps between children of different socioeconomic status. Therefore, the expansion of Grade R is an aspect, a very important aspect for us of access to education, which we believe will contribute to the improved quality education later through the lives of our children. So participation in basic education programs, Chair, for the 7 to 15-year-olds did increase between 97% in 2002 to almost 99%. And again, Chair, in 2016, for children between 14 and 18, we have seen an increase between 88% to 90%. But the challenge is, Chair, because the question will be, where is the other 10%, which comes to your point, member of the DA. The majority of children that were missing to have 100% enrollment, children with special needs, which we are working very hard with provinces to ensure that they attend school. But the majority of children not attending school who are able-bodied are here in the Western Cape and are children in the farming communities. And because all children in this country are our national assets, we're also working with the province to improve access, so that sometimes when we boast about which province performs well, look at all indicators. We look all indicators. So the participation rate, as I said, have been growing throughout the years for both your lower classes and senior classes. And the disparities between male and female have also improved. We have leveled out, and we're very proud that because of some of the policies that we have put, like the policies of allowing young girls, young mothers to come back to school, has helped to improve, to stabilize the system. But also some of the pro-poor packages that we have put in place, like the school nutrition program, we have evidence that they've helped us to retain learners. But there are challenges, Chair, which we have to acknowledge, that the completion rates are not where we want them to be. The number of learners who register in the system are very different from the number of learners that complete the system. We have improved from 40% completion rates, we're just slightly above 50%, and we're putting all sorts of programs to make sure that we can assist learners and tracking the reasons why our children are going out. And amongst other programs we've put in place to improve our access, because it's not access for us It's retention which is a problem. Your dropout rates and repetition rates are the challenge in the sector more than access itself. And some of the programs that we have put in place, it's your scholar transport, which I admit with colleagues is not adequate, but we're working very hard to make sure that we improve that. It's the support for learning and teaching in schools, where indeed we have early identification, and we are working hard to also see if we can put remedial education in place. It's learner well-being around bullying. We have a report which indicates that bullying also is one of a major factor that affects our learners, their health and their well-being, which is an area that we've not been very good at. To retain also, or to make sure that we have throughput rates which are acceptable. We have launched a second chance program, again to make sure that our learners don't leave the system without a skill or a qualification. And have started from this year, introducing what we call a 3-stream program, which has both technical, vocational streams, to make sure that there is also more opportunities or choices that they have, but also learners who are not coping with the academic curriculum are able also to get a skill that enables them to survive. As I say, the 20%, the biggest issue for us is the dropout rates, the retention rate, and we see that the majority of learners who drop out, amongst boys, it's questions of youth criminality and all sorts of youth delinquency, and amongst girls, unfortunately, it's the gender roles that poor communities continue to impose on girl children, your family commitments, early marriages, and teenage pregnancy. And again, we're working with the Department of Health to make sure that indeed we can do that. So as I said, our biggest problem, Chair, and that's why I had put some issues about quality, because it's one of, I think, the biggest problems that I think we have to look at, because access as a country, we're doing quite well. We're competing with the international countries, your top performing countries. It's in the area of quality that we have to pay attention, because that's where as a country we're not doing quite well. And that's where we need to focus, because we can sing our praises the whole night, but the point is, if we don't focus where the problem is, which is quality and efficiency, we'll not be doing quite well. For instance, we will be releasing reports next week, and the report that I'll be releasing next week, Chair, it's our international assessment report. And again, I want to warn people that we will be releasing it. And unfortunately, because it's not our report, I'm not able to share the information with it. But just to say that in the report, out of the 196 countries of the world, 39 countries participated. And we're proud that we participate in these assessments so that we can gauge ourselves against countries and identify areas that we need to improve in. And I think we want to encourage especially public representatives to also pay attention, so that when you say education is a societal issue, as a society, you can identify some of the issues that come from the report which are beyond the education system. Things like community protests which disrupt attendance, learner well-being, learner safety, support at home, which continue to be some of the constraints that make our education system lag behind. So, Chair, I really want to say again, when we look at the results, we'll also, I think, will help also as a country to say, as Member Shibukwan to say, education is broader than what perhaps other people define, because that definition that she gave doesn't belong to us, but I think she took it from wherever she is. But I agree with her that the definition is much more broader and has to be looked broader. But what is also important and very enlightening, Member Shibukwan, is that the indicators of education should not be narrowed down, because as a member from KZN said, what are our targets? Our target is to improve the uptake of medicine science, and KZN is leading, so it's an indicator which should be factored in when we look at indicators. Limpopo, for instance, is a leading province in the country, because we call it a Limpopo surprise, because it is a province that serves the poor and the rural much more better than any other province. So, which is the performance, because what we did, we removed all the other factors, so Model C schools, which push Gauteng and Western Cape up, and say, of the poor and the rural, which province is doing better? And we're surprised that Limpopo is doing much more better. We're surprised that, for instance, KwaZulu-Natal also is doing much more better. So, because as I say, Chair, we always appeal in education to say, because education is such an important instrument, an important indicator, it will help at some stage if all of us see all South African children, not children in Western Cape or any other corner, children of this country as a national asset, and therefore the needs of all the children being important. So we come here boasting to say this does in Western Cape. It's not very helpful. It's not taking us very far. For instance, here in Western Cape, and we're working with the province, the biggest challenge is your kids in your rural areas where up to now, 20 years down the line, unfortunately, we can take equal blame between the ANC and the DA, still have no access to higher education. Schools run up to grade 4. It's a problem.
No, she apologized. No, it's fine.
So, Chair, I had planned to give you statistics around our appeals, our teams, but because we're going to release the report next week, what I will do, I will make sure that we...
Honorable Minister, Honorable Mpumalanga, you raised earlier on, you raised an issue that you are doing now.
Put something on their heads,
So can you please just come down? Honorable Minister, order, honorable members. Please stop conversing. Honorable Mpumalanga, I brought it to your attention that earlier on you brought something to my attention, and you are doing exactly that. So don't do that.
So thank you, Tebanabak. So, Chair, just quickly, because I only have 2 minutes, as I say, some of the things, what we really want our country to focus on, more important, it's your foundation phase and your primary school education. So that's where things start and end. If our kids don't perform in primary school, which is a predictor for future learning, then we're doomed. And so it's very important that also as NCOP, we also are able to say, these are the indicators we're using for monitoring, and therefore these are the areas we also want you to judge us on. And therefore, areas of reading, for instance, early reading, we're putting in programs and supporting our learners in early reading. We're putting also lots of... So we also are intensifying our programs around your maths and science delivery and putting all sorts of interventions, and again, we'll be announcing them. But as I said, the other important intervention is to also follow up and do a thorough study about all the barriers that seem to haunt our system. So, Chair, in conclusion, as a Department of Basic Education, we remain committed to realizing the right to access quality education for all in South Africa. And to make this a reality, we need to align the commitment of all stakeholders so that we don't play boasting games around it. This is a lifeline. So we can really align even our ambitions as a country in the education system around learning as a key goal, so that even those who aspire to lead us in future know that here, there are no politics, it's about people's lives. They can go and maybe make stories at Marikana, but here there's no Marikana. It's about our children's life. So the South African government will do its part, but we'll need a dedicated effort from all stakeholders, from parents, civil society, donors, teachers, partners, and politicians, because after all, education in South Africa has been declared a societal issue, and I really wish you all the best as you continue to bring to attention the rights to education and to a greater realization of this right through your oversight work, but also holding us accountable. So thank you very much, Chair, for inviting us.
Thank you very much, Honorable Minister. Order, honorable members, it has been brought to my attention that today is a very special day for one of our members. Honorable Charles de Beer is his birthday today, so happy birthday. Honorable. Oh. Honorable Bota, can you continue the debate?
Thank you, Chairperson. The Provincial Week of 12 to 16 September 2016 saw members of this House as well as from the Western Cape Provincial Parliament, embark on a visit to a number of education and health visits as part of our oversight duties. Premised on Parliament's commitment to use 2016 to follow up on commitments made to people, the theme for this particular visit was following up on our commitments to make access to education and healthcare work for all. This is particularly important because it means that our mandate given to us as public representatives, we now have the opportunity to go out and give feedback to the people, but also listen to their concerns, take them back to Parliament with the intention to resolve issues. Chairperson, universal access to quality education is not a privilege. It is a basic human right, enshrined in our glorious Constitution. It is the cornerstone of our society and young democracy, and it is crucial to building the knowledge and skills of our young people and also in nurturing the values and beliefs of our diverse nation. It is thus pivotal to ensure that education is accessible to all. With a budget of just over 19 billion rand for the 2015-2016 year, the Western Cape Education Department is responsible for public schooling in the province and currently has 2,147 schools. The average educator-learner ratio is 1:37 and 1:33 for primary and secondary schools respectively. This ratio is set to increase with the increasing number of learners moving into the province from other provinces around the country. It is important to note that 98.5% of schools in the Western Cape are either no-fee schools or have benefited from fee compensation. The department has also noted that many schools in fee-paying areas are just as poor as schools in quintiles 1 to 3, and as a result has added 216 schools to the no-fee schools list. This not only highlights the Western Cape Education Department's commitment to assisting our poorest schools, but also the department's commitment to assisting our fee-paying schools to accommodate poorer learners. Chairperson, there is some uneasiness regarding the quintile system, but we are confident that the quintile system will be reviewed, and with continued discussion, a positive outcome will be the result. Furthermore, a growing concern is the learner-teacher ratio, which in many parts indicates that our schools are overcrowded and thus placing a strain on school resources and staff. However, Chairperson, one must note that at the beginning of every year, there are many new learners from other provinces enrolling at schools in the Western Cape. This presents numerous challenges for officials and schools to ensure that these learners are accommodated and have the necessary resources they need on their first day of school. More classrooms are required in many schools as the movement of learners continues. This was evident, for example, in the Eden School for Learners with Special Needs.
On what point are you raising, Honourable Member?
Chair, I just want to check where is the duty whip, because according to the
Can you take a seat, ma'am?
Honorable Mampuru is supposed to be in the house as a duty whip, but she's not here.
No, that's not a point of order, Honourable Members. Can you continue the debate?
The school also had challenges regarding incorrect referral of learners. Time will not allow me to get into all the aspects of the visit in as far as education is concerned, but I want to say that we have seen the problems facing our schools, and although great strides have been made to ensure our schools are accessible for all learners in the province, more is required of us. Classrooms need to be built, learner transport needs to be accessible for more learners, and equipment and infrastructure needs to be upgraded. Education is a cornerstone of every society and is the most important investment we can make on our children. We need to ensure that children of school-going age receive quality education that will open opportunities in the future and ensure that we build a functioning society. Chairperson, pertaining to health, quality healthcare under Section 27 of this wonderful Constitution. Access to healthcare is a constitutionally recognized right. Provincial Strategic Goal 3 of the Western Cape Provincial Strategic Goals commits the Western Cape Government to increasing safety, wellness, and tackling social ills. Through working together with the communities and other departments, including the Department of Community Safety, Social Services, Culture, Arts and Sport, I'm confident that the people of the Western Cape will continue to get improved services from this department. The Western Cape Department of Health has a mandate to deliver a comprehensive package of quality health services to people of the Western Cape. A range of services that they deliver include emergency services, fees and tariffs, maternal and women's health, forensic pathology service, home-based care, baby and child services, and rehabilitation. One of the biggest objectives of the Department of Health is to continue providing quality health care and making it accessible to all people living in the province. Private medical health care is quite expensive, as we all know, and the majority of people in the province rely on the services of the Western Cape Health Department. The 2015-2016 annual report indicates that the provincial healthcare system has achieved 82.3% TB cure rate, 203,565 patients on antiretroviral therapy, mother-to-child HIV transmission rate of 1%, 14,150,180 primary health care.
Thank you very much. The Honourable Member, please take your seat. Honourable Mokwele, why are you standing? Ne ke kopa gore se buitle se debate se ska re fa reporto re na le one. Honourable Mokwele, please take your seat. Continue, Honourable Member.
Clearly, the people of this province are receiving excellent services, but we are in no way ignorant of the challenges that face our health system. During the oversight visits, a number of challenges were highlighted. Among them are alcohol-related harms were identified as a major social deterrent within the province, especially in the focus area of our visit. A need to strengthen specialized services as emergency services. Challenges with mobile clinics, more are required to service the farm areas. Distance traveled by people to and from facilities are very long at times, highlighting a need for more facilities closer to the people. We are confident that the recommendations given will be implemented in order to remedy the situation and ensure that all health facilities in the province are capacitated to the required standard. Healthcare 2030 is the Western Cape answer to this and a powerful vision for the future of healthcare in the province. However, the shrinking fiscal envelope will definitely hamper much of the progress and implementation of programs the department has planned. What we can assure the people of the Western Cape that even with these challenges, the commitment and drive to continue providing quality healthcare to them will not be diminished in any way. Also critical to achieving our goals is making quality healthcare affordable for all. There is a need to reform the medical aid industry in the country. Recently, the DA launched its alternative to the National Insurance Act, popularly known as NHI. Without going into much detail, the proposed alternative aims to provide quality healthcare to all at a cost that we as a country can easily afford and, more importantly, benefit our people. The plan can be implemented using our own current health budget. In conclusion, I want to thank the important role that the dedicated staff of both the WCED and Department of Health continue to fulfill in ensuring that we have a healthy and well-educated society. The pressure and environment they work in can be quite unfavorable at times, but day in, they go out with one task at hand: deliver service to all in the Western Cape. The contributions made by the teachers and support staff in schools, nurses, social workers, and everyone else that contributes to making our health system function is truly noticeable and appreciated. The frontline staff in the Boerland area on this provincial visit week have once again demonstrated their commitment, diligence, and compassion in the execution of their duties, and we commend them for this. I thank you, Chairperson.
Thank you very much, Honourable Member. The Honourable Member Mutara.
Honorable Chairperson of the NCOP, Deputy Chairperson of the NCOP, Minister of Basic Education, honorable members, special delegates, our honored guests, ladies and gentlemen. Today's debate takes place a day before the beginning of global campaign on 16 days of activism of no violence against women and children. Allow me, Honorable House Chair, to pay a laudable voice of support to all the activists who continue to carry the torch of resilience in our national quest to wage a fearless battle against violence and abuse of women and children in our society. As we say, count me in. The Provincial Week was established in line with the provision of the Constitution, which obligates the NCOP to ensure that provincial interests are taken into account in the national sphere of government. Therefore, it also serves as a very important mechanism for the NCOP to work with the legislatures, municipalities, organized local government, and government departments and entities so that we work together to confront challenges facing the delivery of services to our people. I must say from the onset, Honourable House Chairperson, that since its inception, the Provincial Week has proved to be a success in giving provincial delegates and the NCOP as a whole information about the needs of the people in the provinces. It has enabled the NCOP to contribute to effective government by ensuring that provincial and local concerns are recognized in national policy making and that provincial, local and national governments work together effectively and efficiently in order to ensure effective service delivery of services to our people. The theme for the Provincial Week this year was working together to make access to education and healthcare for all. Work. The theme gave us an opportunity to follow up on the progress that the Gauteng province is making in making access to education and healthcare work for all our people, especially the downtrodden. As the Gauteng delegation, we were indeed proud of the enormous progress that the province of Gauteng is making in delivering quality healthcare to our people. We were informed that the life expectancy in Gauteng has been on the rise since 2002. Gauteng has the second highest life expectancy in the country at 61.3 years for males and 65.8 years for females, and both of these figures are currently above the national average. Honourable House Chairperson, the Gauteng Department of Health conducts quality of life surveys through specific questions related to health every 2 years. The findings of the survey conducted in 2015 revealed that around 60% of people in Gauteng access healthcare services through public facilities, and a further 9% utilize both private and public facilities. About 73% of respondents who participated in the survey indicated that they are satisfied with the services provided at healthcare facilities in the province. The Gauteng province is also taking a lead in ensuring that people with medical insurance use public healthcare facilities. About 34% of the people in Gauteng who have medical insurance are using public healthcare facilities. In many instances, many of them have indicated that public healthcare facilities in the province provide the best treatment available. We were informed that diabetes and hypertension remain the most prevalent health problems in the province at 15% and 11% respectively. We are indeed proud that the province is working tirelessly to put in place programs to educate our people about the dangers of diabetes and hypertension. The total number of the ideal clinics in the province has risen to a total of 365, and 74 of them are facilities with ideal clinic status. In addition, the department is targeting 165 facilities to have ideal clinic status in the 2016-17 financial year. The MSc for Health, Honourable Mahlangu, informed us that the department is rolling out a system called eBMS that will assist in terms of checking the number of beds available at the hospital and the number of beds that are occupied. Moreover, identity verification systems will be rolled out in several hospitals in 2017 and furthers this to the remaining hospitals in the 2017-18 financial year. We visited a number of health sites where we witnessed enormous efforts and progress in ensuring that the Gauteng province expands access to quality health care to our people. The lack of doctors is a national challenge that is also facing our province. Of course, not all our findings revealed a perfect picture, and that was to be expected. It is in the course of work that human errors will occur. Our healthcare professionals work in highly demanding conditions, and we commend them for their high levels of commitment and integrity and efforts to serve their clients well. Our report to the legislature and select committees for continued oversight on both specific issues and generic findings will endeavour to create a condition as envisioned in the NDP. The MSc for Education, the Honourable Lessufi, indicated that priorities for education in the province are driven by, amongst others, the NDP, as well as the 10 non-negotiable priorities of the province. We have seen for ourselves in the various sites that we visited that the focus of the province is on quality of education, e-learning, and ICT in education, reorganization of schools, grade R, inclusive education, skills development, school infrastructure, and social cohesion. Regarding quality education, the focus, amongst others, is on improving the quality of passes in grade 12 through the implementation of the Secondary School Improvement Program, teacher development, the provision of learner-teacher support material, teaching through e-learning, and district support. The e-learning strategy and ICT rollout includes the connectivity, devices, e-learning content, teacher training and development on ICT, amongst others. In addition, the plan is to also ensure universalization of grade R in 2019, reorganize schools in order that learners are provided with relevant education in a non-racial education environment. This is done through twinning of schools. As an immediate intervention to the reality of the lack of space to build new schools or extend existing schools, the MEC introduced this twinning of schools. This intervention intended to pair what is known as former Model C schools with township schools. For in the words of our MEC, no child must be disadvantaged just because of where they reside or the color of their skins. Those that have must share with the have-nots. But no sooner had this intervention been introduced than the MEC and the department were faced with arrogant resistance and worse, justified with the most baseless arguments which reminded us of the exclusionary and separatist policies of apartheid. So much for freedom, fairness, and opportunity. With regard to school infrastructure, the aim is to replace schools that are made of mud, asbestos, wood, and metal structures with brick and mortar structures, provide schools with electricity, connectivity, water, sanitation facilities, and build new schools incrementally, as well as grade R classrooms to reduce the backlogs. The Department of Education intends to open a new school every month, and all 20 asbestos schools in the province will be eradicated by the end of the 2016-17 financial year. The plan is to ensure that by the end of the 2017-18 financial year, there will be no asbestos schools in the province. While ideal infrastructure and tools of trade are but part of what will ensure better education of our learners, the learning environment as a whole must seek to create a wholly patriotic South African who has passed through a rigorous system that has ensured their full potential has either been unlocked or can be reached in later years. It is regrettable that there are increasing incidents of religious intolerance as well as open racism in our schools in Gauteng. What is even more disturbing is that these cases have been found to be taking place in as early as pre-primary school levels. Our educators have a responsibility to mold these young minds and hearts into South Africans of the future. How will this be achieved if when, at an early age, racism is practiced as a norm and looked upon as acceptable and even justifiable? We do commend the swift action by the MEC in trying his best to address these issues as soon as they rear their ugly head. In conclusion, as the delegation of Gauteng, we want to convey our profound appreciation to the Premier of Gauteng, the various MECs, especially the MEC for Health and the MEC of Education, and members of the legislature for the manner in which they continue to embrace the Provincial Week. We are indeed proud that Gauteng remains committed to do everything necessary to ensure that our people receive quality services. We welcome the commitment to ensure that some of the concerns that we raised during the Provincial Week are followed up and addressed. I thank you.
Thank you very much, Honorable Mutara. The Honorable Member Hudson.
Thank you, Honourable Chair. First, perhaps just a brief response to House Chair, Honourable Nyambi, who called on the Minister to strengthen monitor and evaluation. Well, that's very interesting because the last reports that we've really seen from NEDU doing exactly this was in 2012 and 2013, while the 2014 NEDU report is still being sanitized. Referring to Honourable Peter from the Eastern Cape, very interesting. Come here and boast about a city. Eastern Cape was the province who forfeited the most money back to Treasury and to be redistributed to other provinces. And then he comes here and he blames lack of capacity. Now let's just go to the lack of capacity problem, the root of the problem in the Eastern Cape, and that is the capture of education by SATU, a very delicate subject. SATU has captured Eastern Cape education, and by doing so, stealing the future of our children, stealing the education of our children. And that's why children are fleeing from the Eastern Cape, because of the capture of education by SATU. Not to the northwest. I hope they
You're
come
covered,
there.
Honourable Hudson.
On the
Don't
14th
listen
of
to him.
December, the Minister of Basic Education publicly reported on the progress made in delivering school infrastructure in terms of the regulations relating to the minimum uniform norms and standards for public school. According to her statement, 100% of Northwest schools have water, 100% have got sanitation, 100% of Northwest schools have appropriate infrastructure, and only 4 schools are without electricity. Now, perhaps the Minister regards water as in a JoJo tank from rain as sufficient water. Even if we look what's inside that water.
But what do you call it?
That's not water, clean, potable water that we want to give to our children. Now, I want my colleagues who are part of this oversight visit to Morokweng and to Ganyesa and to Tosca, is this the truth, the whole truth, nothing but the truth? It's not. It's certainly not. So the Minister comes here and tells us we must focus where the problems are. But Minister, how can you focus where the problems are if you are in a state of denial? Children are without sanitation. There are pits, open toilets built for a few children 20 years ago, overflowing without doors, and you say that is sanitation. There's no problem of sanitation in the Northwest Province. Honourable Minister said you must focus where the problems are, and I appeal to the Minister, focus, Minister, please focus, don't be in denial. Perhaps the Minister should have been invited to have accompanied the select committee.
Honourable Hutton, please address the Minister.
What I've said through the chair, thank you, I'll do that. Perhaps the Minister should have been invited to accompany the select committee into the rural areas on our oversight visit. And I want to, because the Minister clearly is either being misled or something else, but the Minister should come with us, go with this committee, go to the rural areas in the Northwest Province. The reality is that the situation found in our schools in the area is a far cry from the idealistic picture portrayed by the Minister, basking in the delivery at an expensive media event where all the lights are on her. There's no...
Order, Honourable Hutton, please take your seat. Honourable Mkhosi.
Koni.
Are you no more Honourable Mkhosi?
Koni.
Honourable Koni.
Eh.
Oh, Honourable Koni, okay. My
Chairperson,
apology, ma, Honourable
ke ne ke
Koni.
kopa gore o nkopele re hating gore o buela go godimo and ha o se ga ya tlala gompieno ma ANC ga tla le ene self wa drown as a member on the podium
Honourable Koni, please take your seat, ma. Honourable Hutton, continue to debate.
Thank you, Honourable Chair. There are so many quotes that I can give you from our Provincial Oversight Week report. Ceiling damage may be danger to children. There are no classroom. The province said the dilapidated classroom with broken windows should be taken down. There is no kitchen to prepare food for the NSNP program. There are no storage for it. Inadequate pit toilets installed 20 years ago without doors. There are no sport facilities. In fact, what we have in the Northwest Province in the rural areas is really a scandal. And the Minister comes there are no problems in the Northwest Province. 4 schools without electricity. Now, Honourable Chair, in general, it was found that even where there are infrastructure services in existence, there is no maintenance or the infrastructure
Honourable
is in a
Hutton,
state of
your time has
I'm
expired,
concluding.
sir. Honourable Hutton, your time has expired.
I welcome the
Thank
Minister
you
to
very
come with us.
The Honourable Member Gaila. Order, honorable members.
Honorable Chairperson, Honorable Minister, Honorable Chairperson of the NCOP, Honorable members. The United Democratic Movement is shocked that the Eastern Cape Department of Education, by its own admission, has built a total of planned 24 schools in 2015 and 2016 financial year. In terms of estimates of provincial revenue expenditure report, there are currently only 3 additional schools under construction as of 2016. There were planned targets for schools to have water, sanitation, electricity, yet as of August 2016, there is no information on actual number of schools provided.
Order, Honorable Gaylor. Honorable Gaylor, please take your seat, sir. Honorable Faber.
Chairperson, I'm quite worried at the quorum of this House at the moment. It seems that the majority party, I don't know if they lost the airplane
Honorable Faber, please take your seat. I want to address you. Take your seat, Honorable Faber. This House has got the chief whip who is taking care of it. Continue, Honorable Kayla.
Given the underperformance in school construction, which resulted in Eastern Cape Department losing into the national fiscus not less than 500 million due to under-expenditure. School infrastructure is a national crisis, and these visits have once again confirmed this fact. It runs deep into our system of basic education. The latest National Education Infrastructure Management System data released in June 2016, Chairperson, just protect me.
The honorable member, order. Honorable Hatton, Honorable Prince, Honorable Faber, Honorable Ntebe. Please respect the member who is on the podium.
Released in June 2016 reports that 9,203 schools still have pit toilets. 3,492 have no or unreliable electricity. 175 have no or unreliable water supply. The Eastern Cape Department of Education must attract and maintain infrastructure employees, ensure that implementing agencies are doing their work without email administration, integrate the schools infrastructure program with schools rationalization program. Above all, the department must disseminate regular progress reports to public and share the annual implementation report and plans. This is important for ongoing monitoring of schools infrastructure delivery, that the safety of learners and educators is no longer compromised. Chairperson, like basic education, involving communities in primary public health provides basis for increased self-confidence, self-reliance of individuals and community as a whole. Amongst the disadvantaged and underserviced communities, participation gives practical force to ideas of health as human rights and social justice. Chairperson, what is worse in rural clinics, some of them are closed over weekends, and this is disadvantages the rural community. If community members are involved in planning and development, implementation of health services, then services are more likely to address real needs and less likely to be misused. In this regard, the UTM suggests that we move towards commitment to community participation as a part of primary public health and care and district development. A commitment to community participation remains a cornerstone of primary public health and would certainly result in proper infrastructure. Lastly, Honorable Minister, in our visit, some of the teachers complained about rural allowance. It is a pity that some teachers receive and some don't receive rural allowance, and we would urge you to attend to that problem because it's unfair that some teachers do receive this allowance and some don't receive this allowance. I thank you.
Thank you very much, Honorable Gaylor. The Honorable Member Ventful from Mpumalanga.
Thank you, Honorable House Chairperson.
Order. Honorable Gaylor, please take your seat.
The Honorable NCOP Chairperson in attendance, and the Minister of the Department of Basic Education, Magam Tsecha, honorable members, permanent delegates and special delegates. It's a pleasure to participate in this debate, ably opened by the Honorable House Chairperson Nyambi, as we reflect on the work which we did between the 12th and the 16th of September 2016. I must indicate upfront, Honorable House Chair, that in Mpumalanga, the Provincial Week was integrated with our program of taking the legislature to the people. That had a bonus and an advantage that we're working together with our permanent delegates, including members of the Executive Council and also our honorable councillors within the municipality of Likwa, which is part of the Gert Sibande district municipality. While we also concentrated on the themes which were highlighted by the NCOP, health and education, but were broadly working under the theme of the legislature intensifying oversight for proactive and service-oriented governance, advancing people's power. We must indicate that while we were mainly based at Sakile Stadium, we had oversights which were extending to even the farming communities around Standerton and Mochensin, and we also had stakeholder forums which focused on matters dealing with the youth, where issues of drugs, youth involvement in sports, and also looking at measures to create jobs were deliberated upon. The other stakeholder forum looked at how we can develop the economy of Likwa as a municipality, in particular the LED of that municipality that focused on the business people, both emerging and also the established business people. And the last stakeholder forum concentrated on our elderly and people living with disabilities, where we're looking around the issues of how can we ensure that their livelihood is being taken care in a manner which is very much dignified and bestowing the respect which they deserve. I must indicate, presiding officer, that Likwa municipality is located within the district Gert Sibande and is one of the densely populated areas in the Mpumalanga province, which is hard hit by rapid urban population growth and the demand for services. And a long chunk of the urban population within Likwa municipality is unemployed. And most of those unemployed people, they largely involve the youth. We must also indicate that as we did our oversight visits, we did visit at schools. In most of the schools, there are good stories to tell. In most of the schools, there are not so good stories to tell. But we must indicate that because there was the presence of the department in some of the schools, like for example, East Fiso Setu Primary School, where there were challenges of overcrowding, the department has committed and also delivered 9 mobile classrooms in order to relieve that particular challenge which the school was visiting. And we take this as one of the impact which the Provincial Week had in terms of our province of Mpumalanga. In the area of Mochensin, which is a small town, a bit of a distance from Standerton, we got that there was a clinic which only operated 5 days per week. During the weekend, it was not working. And as we know, illnesses do not have any day of the week. And there was a commitment from the Department of Health that is going to be opened for 7 days per week. And I think that is one of the positive impact of our Provincial Week. We also came across situations where libraries were not well resourced, because I must indicate, presiding officer, that the libraries in Standerton, 4 of them, were still located in terms of the apartheid planning. A library for the former colored areas, a library for the former black people in the township, a library for the former Indians. And there has been an agreement with the Department of Culture, Sports and Recreation that a bigger ideal library will be established for all the people of Lekwa municipality. I will not go in detail because our report is there, it's well written. People who want to share it are welcome. But, Honorable Presiding Officer, I'll be failing in my duty if I don't also make certain observations, especially what was raised by the Honorable Mpambo Shipukwane, who is currently representing Western Cape, but I think originally she is from the Eastern Cape. Because we are here equally as South Africans and we should not undermine each other. Chapter 3 of the Constitution enjoins us to work cooperatively rather than to compete and even not assist each other. If we view ourselves patriotically as South Africans, we can't laugh at other provinces which can't perform like the others. Because if you look, it's a fact, Eastern Cape inherited 2 Bantustans. That was Ciskei and Transkei. And I believe the other member was debating here on behalf of the UDM. His leader was one of the leaders of those Bantustans. The point I want to make, presiding officer, is that Western Cape does not suffer the legacy and backlog of provinces which inherited Bantustan homeland governments. And that we must, so that we compare apples with apples. But as we conclude, I hope that the children of the Eastern Cape, innocent as they are, if they enjoy their right of freedom of movement to go to any part of the country, including Western Cape, they will not be called refugees in the country of their birth. I am coming from Mpumalanga. Mpumalanga, it's neighboring Mozambique and Swaziland. When the wars were there and Portuguese people were crossing over to Mpumalanga, the white government ruling by that time was welcoming the Portuguese people, giving them business and so on. That's why they are running restaurants and so on in Mpumalanga now. So if we welcome our own people now, after they've been pushed by the effects and legacy of the civil war, of Renamo, sponsored by the apartheid regime, we welcome them with open hands. We don't say they are refugees, because we take them as Africans. So I think we must let that African spirit prevail amongst us, irregardless of the parties we belong to. Thank you very much.
Thank you very much, Honorable Member. The Honorable Member Zwane.
Thank you, Chairperson. Honourable members of the August House, let me start off by saying that and reminding the public and honourable members that the ANC has been a leader of society for the past 104 years. And that has been the case because the ANC is genuine in its commitment to improve the socio-economic status of the people of South Africa. The ANC is genuine in the commitment to fight the burden of disease and therefore increase the span of life of the people of South Africa. And the ANC, among other things, is also genuine in ensuring the provision of quality education in South Africa. That is why it is important for us to keep the connection with the people that we are serving. Hence the importance of the Provincial Week, the importance of taking Parliament to the people, to maintain the connection with the people. There is nothing that pleases people more than seeing their government, their public representatives coming to actually address them and listen to their needs and take care of their requirements. There is nothing more fulfilling to the people like seeing that the government of South Africa has got a plan, the NDP, to ensure that there is a planned and systematic service delivery. There is nothing that pleases people than the warmth they feel when we go to them. If Mohammed cannot go to the mountain, then the mountain must go to Mohammed. So we actually go to the people to listen to them with a view to ensuring that we assist them. One other reason why people believe in the African National Congress is that the movement has mastered the terrain of the electoral contest. And the ANC has been able to utilize political powers to advance the objectives of the NTR. And the ANC wields the instruments of the state in line with the ideals as reflected in the constitution of the country. The ANC has led this country, and it understands the connection between political and socio-economic challenges of this country. That is why we appreciate the move by the ANC-led government to put a proposal for a minimum wage of 3,500. People are going to live better than they lived yesterday because of the leadership of the ANC. Now, I just want to respond to my colleagues here that were passing some funny remarks about the leadership of the ANC. One, Honorable Kaula, it's a pity that he's gone, says that in Vulekani school, the one school that we visited, there was abuse of children there. I just wanted to remind him that soon after we had left, the teacher that was involved in the abuse of children in that school has since been suspended. And number two, he says that in St. Margaret's, that hospital has been neglected. It has been promised by the MEC that it was going to be rebuilt. I want to assure him that the case of that school is being taken up. The Minister of Health has been to that hospital soon after the NSOP had been to that hospital during the Provincial week. So that matter is being attended to. And then the EFF. Koni comes here.
Okay, honorable members, order, honorable Mutara. Honorable Zwane, please take your seat. Honorable Koni, why are you on your feet?
The honorable member on the podium and address her as honorable member. I'm the honorable member of this house, please.
Okay, your order has been sustained, Honorable Koni. Honorable Zwane, she is Honorable Member Koni.
Chairperson, when the EFF addresses this house, they will refer to our president as Zuma. They will refer to the deputy president as Cyril or Ramaphosa, but they expect me to address them as honorable members.
Order. Honorable
I'm not going to do that. They must learn to respect other people before they can be
Honorable
respected.
Member Zwane, please take your seat. Honorable Mukwele, nkanu yemika mautuma.
Ke a leboga modulasetulo. Wa bona mme a se ka tsaya chance.
Honorable Mukwele, you know very well that you cannot debate from the floor.
Face to face.
Honorable Mukwele.
A ile gore o ikella gore ga re bitse bo honorable. Re tla mo fa sa se batla.
Honorable Mukwele, we have rectified that one. Please take your seat.
Ke kopa gore o rule mmeo a re bitse di honorable. Fa re di colleague fa we are equal. If you deserve respect, we'll give you respect. If you don't want our respect, we'll do as
Honorable
such.
Mokwele.
So if she doesn't want us to respect her, we will do so.
Honorable
We have
Mokwele.
all the capacity to do that.
Honorable
Eh.
Mokwele, Honorable
JZ
Mokwele,
ke motho
please
wa
take
bona.
your seat. Take your seat, Honorable Mokwele. Honorable Mokwele, please. Honorable Mokwele, please. Honorable Mokwele, please don't be out of order. You've heard us when we were asking the Honorable Zwane to call Honorable Koni an honorable member. Please allow the House to continue. Continue, Honorable Zwane.
Kwehla ngamphimbo omunye, Sihlalo. Okwenza kwabanye kuyenziwa nakuwena. Kwehla ngamphimbo omunye. Ukuze uhlonishwe, kufuneka uqale uhlonipha abanye abantu.
Honorable Zwane, the honorable member is still standing on her feet. Honorable Mokwele, why are you standing?
Chair. Ke kopa so se le sengwe fela. Ke kopa gore mmeo a bitse mme Koni ka mokgwa or ka molao wa ntlo e. Pele a tswella go ira sengwe le sengwe a ka nna a bua ka seZulu sa ge le rona re tla bua ka Setswana sa rona. Ga e le gore wa re roga ka seZulu sa ge le rona re tla fetola ka Setswana sa rona. Yaanong a dire se se tshwanetseng jaaka molao le molawana wa ntlo e o ka. A bitse mme Koni ka pele a tswella ka puo ya gagwe a bitse mme Koni ka mokgwa go tshwanetseng.
Honorable Mokwele, re a leboga mma. Ke nagana gore taba ye o re e feditše ka yona re mo kgopetše gore a se sa bitša Honorable Koni a re Koni o swantše gore a re Honorable Koni. O re theeleditše re feditše ka taba ye a ka sa e bušeletša ga a ka e bušeletša o taba re go wela. Honorable Mokwele, you cannot do that. Honorable Mokwele, you cannot do that. Honorable Mokwele. O kgopela thompho mara wena tšeo di diang a o nthompe. Ntheeletše re more. Honorable Koni, I did not give you a chance to speak. I did not allow you. The honorable member stood before you. Take your seat. Honorable Timbi?
Chairperson, I think we are here in Parliament. We are not in a shipping. Then I think, Chairperson, we have to rule. Use your rules. It is unfair ukuthi in Parliament kwindle ehlonipheke kangaka sigezelwe. It's unfair. And imbeko ayingombeko. It's unfair. Ayizange bekho iParliament enjengale. Sigezelwe ngabantu abancane kangaka. Honorable members ezincinci kangaka. No, it's unfair. It's unfair, Chair. You have to rule.
Okay, Honorable Timbi, you're repeating what we were saying. Honorable Koni, now is your chance. Honorable Mokwele, take your seat. Are you rising on a point of order? All right.
Honorable Chairperson, ke kopa consistency go tswa mo go wena. Ka nako e ntsi ha o chaira, o na le go sa nne fair ka nako tse dingwe. Ga ke bue ka lenyatso mma, ke buela ka se se diragalang. Ke kopa gore hela ka itle ke eme ha le ke sa bue sentle ka resume. Ke be ke bua gape ntha hore ke kopa gore o bitse resume kgotsa mo president. Ke be ke go direla yalo. Ke kopa re mmele ne a ntirele jalo ka gore mme o hetsa go ikana gore a ka se mpitse a re honorable. Ke kopa gore mme o pela ga tswelela ka debate ya gagwe a simololela ka go addressa kganyela gore honorable Koni ke sa ntlha se wa mma yana ka gore pipela ga o mpha chance re Qimbi ya ba pagama stilo re Qimbi o hetsa gore bitsa bana ke kopa re Qimbi a withdraw le foko lewa la gore ga batle go tlolwa ke bana o bua ka di shebini ka gore wa itse re itirile moruti mare wa tago ke a leboga.
The Honorable, I will start with Honorable Member Zwani. Honorable Member Zwani, did you say you will never call the Honorable Koni, Honorable Member Koni? I just want to check because she was using her language and you said, yes, we just want to, can you give us a chance, Honorable Mukwili? Did you just say?
Okwenza kwabanye abantu.
Honorable Zwani, please.
Expect
Honorable Zwani, Honorable Zwani, please.
I never said I will never call her honorable. That is what I said.
Okay. You just heard her, Honorable Koni. Or there's no translation. Okay. She is refusing. Akiri, you said, Agasovicha, Honorable Member. So she is refusing. She will call you an Honorable Member Koni. Thank you very much, ma. The Honorable Member, Honorable Mukweli, please take your seat. Take your seat, Honorable Mukweli. We're still dealing with the point of orders that was raised by your Honorable Member. I will recognize you after I am done with the ruling. Honorable Trimbi, did you just call the Honorable Member's children?
No, kangendi chobaba ndidi honorable members, the honorable members.
Okay, I will go and check with the Hansard and come back with the ruling. Honorable Koni, take your seat. Take your seat, Honorable Koni. I am done with this one. I'll go and consult the Hansard and then I'll come back with the ruling. Yes, I'll do that. I will do that. Honorable Mokwele, you were standing. You will be next, Honorable Ntebe.
Ke a leboga modula still. Ke a leboga modula still. Ke kopa go tsaya tšhono e, modula stool, through you, to put it on record that ga re itumelele ka mokgwa o maloko a ntlo ye a re tsayang ka teng. Ga re bana mo ntlong ye. Ebile ga re atla fa go tlo tshameka. Ebile re na le di community tse re di represent.
Honorable Mokwele, what is your point of order?
Ke kopa gore maloko otlhe go tloga yaanong a re tseye tsia a se ka re nyatsa ka gore ka Setswana sa etsho ra re susu ilela suswana gore suswana a tla go ilele. Susu ilela suswana gore suswana a tla go ilele. Ga e to ke puo ya setho.
Thank you, Honorable Mokwele. Order sustained. Honorable Ntebe, do you still want to say something?
Chair, can I plead with you that you also check through the Hansard the latter part of the comments made by Honorable Koni, attributed to Honorable Trimbi, which are very insulting, which are tarnishing the image and the persona of the Honorable Member. Thank you, Chair.
Okay, thank you very much. I will do that, Honorable Ntebe, and come back with the ruling. Thank you. Continue, Honorable Zwani.
Thank you. Then let me address myself to the DA. Unfortunately, Honorable Hatton has left the house. I wanted to say those who live in glass houses should not throw stones, because here in the Western Cape, there are schools in townships with broken windows. There are schools in townships where there are no doors because they are not properly taken care of, simply because they are in townships. So in his comments, he must be fair. In the area of Manenberg, for instance, there is a lot of drug abuse that is not being attended to adequately. There are no police that are sent there to go and conduct the searches, and therefore the teachers and the students operate under the fear of gangsterism that is very rife in those schools in that area there, but he's not saying anything about it. And also the health facilities in Khayelitsha. that are overcrowded, and those clinics that are in farms, where the nurses or the professional people there, the health professionals, are using Africans, servicing patients that are Xhosa speakers. And therefore, there is no understanding. They end up getting unfair service and inappropriate medication because there is no understanding between the professionals and the patients. And I think that is very deliberate. It's only because they are servicing the blacks.
Sorry, Honorable Zwane, please take your seat. Honorable Mokwele, why we here make a mouth?
Ke a leboga modulasetulo. Ke ne ke re ke re chief whip ke re teng ka mo ntlung rona ke ma ANC le ma DA.
Honorable Mokwele, you are out of order. Please take your seat, Honorable Mokwele.
We are present. We've just received messages that we must come back. We are present. And 99.9 present SEFF. We are doing our work.
Okay, Honorable Mokwele, take your seat. Take your seat. Continue, Honorable Zwane.
Thank you, Chairperson. So I just wanted Honorable Hutton to hear that, and he must be fair in his comments and not look at what the NC is doing. And if they are failing to service the Western Cape alone, how much more the entire South Africa? They cannot even attempt it. I just wanted to say that, Chairperson, the Provincial Week focused on education and health. I'm going to touch on a couple of issues. I heard the Minister talk in her debate about the fact that the Department of Basic Education is investing a lot of money in ECD, which is highly commendable because we do need to make our foundation very firm at lower stages of development if we hope to achieve quality in the final analysis. And we really do appreciate the fact that you are actually subsidizing ECD centers and that 1.5 million children in South Africa are able to access the centers, and that you are paying 15 rand per day for each of those children over 264 days that they attend ECD education. That is highly commendable. And you also said that the issue of learner transport is being attended to in the schools that went to in KwaZulu-Natal. There was an outcry about the fact that it's not all the schools in the rural areas that are benefiting from learner transport, and maybe that is an issue that you need to attend to when you work on the budget. In Tugayana, for instance, we visited that school. There was an outcry for learner transport, but also the issue of infrastructure and the renewing and upgrading of schools was a big problem there because of land ownership problems. A number of schools in rural areas have got a problem of land ownership, particularly those schools that are in farms. Maybe the department, together with local government, need to collaborate in order to ensure that we resolve those issues, because those schools can't develop where they are. And then Tugayana is one such school. In Vulegani, the school, the special school, there the problem is the professional services that are needed there.
Honorable
because
Zwane.
the students there are not only physically
Honorable
challenged.
Zwane, I'm afraid your time has expired.
Thank you. As I round off, they are also
Please take your seat,
intellectually
ma'am.
challenged.
Take your seat. Your time
So
has
we
expired.
need a lot of professional services, including the health services. Thank you. Thank you, Chair.
Thank you, Honorable Member Zwane. I want to humbly request the Chief Whip that they need to restructure the way they communicate with the members. Maybe they need to start by acknowledging those who are in the House, and you will to request those who are outside to come back to the House. Please, Chief Whip. Thank you very much. I shall now call the Honorable Member, the House Chairperson of Committees, Honorable Nyambe.
Thank you, Honorable House Chairperson. Let me be upfront and thank the Minister for being available for this very important debate, but indicate that all this is because of the manner in which the POs under the leadership of our Honorable Chairperson of the National Council of Provinces, Memo Dise, is able to lead us as a National Council of Provinces. The whole purpose of today's exercise is to deal with education and for government to decide that education is its apex priority. It's just responding to two things. One, it's acknowledging that indeed it's only education that you can be able to deal with the challenges that we are facing as a country. And it means for us to be able to build a better South Africa, it can only be done through education. We started the 5th term, Honorable Minister. We agreed when we had the workshop as an NCOP that we want to have an activist NCOP that will lead to activist oversight. I want to challenge all members of the National Council of Provinces today, irrespective of a political affiliation. I was listening attentively and towards the end, listening to the fights. Well, I was a little bit disturbed, but what disturbed me most is that the fights, irrespective of a party you are representing, is not about how we're going to be able to have those that are accountable to these committees account. We're not fighting about that. I'm looking forward to a day where we'll fight more about how we're going to be able to have those that are coming to us to account. And as a National Council of Provinces, under the leadership of our chairperson, we have different programs. We have the Oversight Week, we have the Provincial Week, we have the Local Government Week, we have got the very same taking Parliament to the people. And we agreed that at all times, Honorable Minister, when we go to Mpumalanga or Eastern Cape and we request honorable or members or officials or the department to be represented, it's not because as NCOP we are on a fault-finding mission. We'll always give credit where it's due. When we're Eastern Cape, we're very inspired to see a 94-year-old in Makaula Secondary School as a chairperson of the SGP, very articulate. He challenged us that before we started the meeting, can we discuss the appalling situation of what we see happening with universities in South Africa? It shows us that if you have effective, efficient SGPs, it will always assist our schools. I'm standing here today. I can tell you that the school that made me to know how to write, they regard me today as a patron. I'm a father of that school. I've got a responsibility. I'm not even a member of SGP of that school, but I'm a father of that school. I made sure that they have a library. I made sure that they have books. And for your information, honorable members, the library that we have here in Parliament every year is discarding books. And it's our responsibility to take those books to those rural areas where we are coming from and assist those poor schools. So we are part of that program to assist Minister. And Honorable Vivi Venful was very clear in articulating what is happening in Mpumalanga. In Mpumalanga, it's part of the story that we have to use, Honorable Chief Whip, to share as the National Council of Provinces. Every time when we go to a provincial week, we are afforded the opportunity as NCOP members to have the Premier, the DG, presenting to us what is happening. and the Speaker will avail all members of the legislature, and they're always part of our program, and that assists us when we come back. I deliberately to start and reflecting about other provinces because of the information that is in the office, as I knew that Honorable Venful was going to be able to reflect about what is happening in the province. Honorable members, we have got 3 tasks, nothing beyond that. Let's fight about oversight, let's fight about public participation, let's fight about legislation of which is lawmaking. Let's leave all the other issues. Those that are looking at us, they know that education is key, and education is going to make them to be better. I want to conclude by saying, House Chairperson, maybe sometimes when we say ANC wants to advance and deepen in national democratic revolution, without simplifying it for all South Africans and honorable members to understand, it's a foreign and complex thing. In simpler terms, it means we want to build a non-racial, non-sexist, democratic, and prosperous South Africa. There's no different as parties. All of us were saying we want to build that. We're just differing in terms of strategies. I'm appealing to you, honorable members. I'm appealing to you, honorable members. I'm not even attacking any part. I'm appealing to honorable members. Every time when we get this opportunity, let us fight about the strategy of engagement to those that are supposed to come to us to account. And if we're going to be realistic to that at all times, let us avoid just the comfort of opinion without the discomfort
Honorable Kony,
of
please.
thought.
You know, haggling is allowed, but you cannot drown the speaker.
House Chairperson.
Honorable Kony, please. Continue, Honorable House Chair.
I'm concluding, Chairperson, by saying honorable members at all times should just not enjoy the comfort of opinion without the discomfort of thought. I thank you.
Thank you very much, Honorable Member. That concludes the debate. I shall now put the question, and the question is that the report be agreed to. Honorable members, in accordance with Rule 7.1, I shall first allow provinces the opportunity to make their declaration of vote if they so wish. Okay, we shall now proceed to the voting on question. I shall do this in alphabetical order per province. Heads of delegation will vote by pressing in favor, against, or abstain. Eastern Cape.
Eastern Cape support, Chair.
Free State.
Free State, yes, supporter.
Gauteng.
Gauteng agrees.
KwaZulu-Natal. I'll come to you, Honorable Member. We are voting now.
KwaZulu-Natal, yes, Sihlalo.
Limpopo.
Limpopo, yes, support.
Mpumalanga.
Mpumalanga support.
Northern Cape.
Northern Cape, amogela.
Northwest.
Modula stilo ramogela rapport.
Western Cape. No, we have members from the Western Cape in the house. Western Cape? Okay, she can go. Oh, all right. Honorable Prince, I'm very sorry you can't vote because you're not the leader of the delegation. Let's conclude this, Honorable Mokwele. I'll come back to you. I did not forget about you. So 8 provinces voted in favor. So voting will now close. I therefore declare the report agreed to in terms of Section 65 of the Constitution. Honorable Mokwele.
Chair, in terms of Free State, Honorable Mohapi didn't have the mandate for the province. I sit in Wipari, that's why I know. I sit in Wipari.
Okay. All right, thank you very much. Mandate are not required, Honorable Mokwele. Thank you very much. That concludes the House, and the House is adjourned.